gonna gonna jump into it. So, um, I wanted to, I guess, start by sort of thanking everybody for coming out. I appreciate, I appreciate your business certainly, and appreciate you taking the time to come on tonight. I tend to think that this is kind of really sort of important part of the process. You learn a little bit about the product and about the service. In some of our, like, through our initial calls and initial correspondence and things like that. But for the most part, once you've received some product, you've got it in your hands, and now we're going to do this walkthrough and a kind of a rehash of some of the information and the kind of science behind how the product works and the way that the way that the process goes. It tends to kind of make a little more sense, in this context. Again, when you have product in your hands and you're kind of you're ready to go right after this, and there's not going to be this waiting time in between and so forth. So, I tend to think that these sessions, these kind of standard protocol training, the Q&A that we're going to have here, is hopefully very helpful, in getting you prepared and ensuring that you have sort of the next level of confidence as you move forward using the product. I'd ask that, as we go through things, if you have any questions or whatever, maybe just like pop them into the chat, into the chat window, note it down or whatever. And then once we've kind of gone through the information, we can do some of the question and answer following. And, that's the other thing too, is I think these group sessions are a lot of times a good forum for, just seeing some of the questions other people are asking, and asking your own questions. But it kind of, it's a little bit outside of the box in that sense. So you're going to think of a couple things to ask, and other people are going to ask things you didn't think of, and so you're going to gain some knowledge that way too. So I just, again, tend to find these to be quite helpful, and even more so than some of the one-on-one sessions I do and that type of thing. But with that being said, I do want to start. I'm going to start just on a sort of a short presentation, kind of walk through again, what is this product? What does it do? How does it work? And get us in the right sort of frame of mind to start talking about the specific details of the product and the standard protocol. So I will just share my screen here real quick, and we'll get to starting with that. Okay, I suspect everybody can see the screen here. So I'll get going. The BioRePeel product. Okay, we again, we have two sort of primary products, flagship products in our line here. We have the BioRePeel Blue, which is the that 35% TCA formulation. It's primarily made for face, neck, and décolleté use. This is is a medium depth TCA product, but the sort of three pillars of our positioning in the marketplace are no peeling, no pain, and no downtime. During the procedure, it shouldn't be painful for the patient. 90% of the time, I'm asking people, what, on a scale of 1 to 10, where are you? It's a 1-2. Okay. If you're going to be, I don't know, doing some dermaplaning or some micro needling or whatever, okay, maybe it's going to be more like a 4 or 5 or whatever. But as a general matter, you're never going to be in a situation where people are going to be, really burning up from this product or feeling a significant level of discomfort. I don't recall ever seeing a fan come out in a BioRePeel session. Okay. It may happen, but it's never happened in front of me. So, with that being said, you have the high TCA content, which is going to, deliver these kind of clinical results that you're looking for when going after, true sort of clinical skin conditions and concerns, but without that pain during the process and without the peeling and the downtime that typically follows. The product's going to be suitable for use with all Fitzpatricks 1 through 6. It's going to be suitable for these various skin conditions that we've discussed, with the hyperpigmentation, melasma, acne, scarring, lines and wrinkles, rosacea, and so forth, and is going to be good for use all year round. So you're not going to be in a position where you've got this, like, traditional sort of peel season. This is a product that's going to be used, December through December, regardless of climate and so forth. And I mean, we've had a tremendous amount of success in the southern states, and really all over the country, but in the southern states in particular, because I mean, listen, where I live, it's summer all year round, and if there's a peel season over here, it's like I don't know how you operate under those circumstances. So, all year round peel, and again, applied to the face, neck, and the décolleté using the blue product. The application of the product, the standard application is a topical application. There's no magic special process involved, massaging with 4 pounds of pressure. We don't do any of that stuff. You're going to apply the product to the skin. You're going to work it so that it activates the product and combines the ingredients. And then you're going to move to the next area and apply it to the skin and work it so it activates and combines the product. But you don't have to be doing any kind of massaging or anything specific to try to stimulate the absorption. That's going to happen by itself as a result of the chemical composition, which we'll kind of talk about a little more in a second. But the product is also multifunctional in the sense that you're going to be able to do this as a kind of a layered type of a treatment approach together with other modalities. So again, dermaplaning, hydrofacials, microdermabrasion, microneedling, microchanneling, these jet plasma devices, the ProCell devices, like all these types of kind of mechanical injury systems that you could use beforehand for kind of skin prep and cleansing and exfoliation and opening up the pores and so forth. You're going to be able to use this product in concert with those other products or with those other services, and have a kind of combination therapies on your menu in conjunction with just a standalone topical type of an application, so that you can really kind of customize the treatments that you're going to provide to people with different skin conditions and different skin concerns. There should be an expectation, however, that you're going to see some immediate results. So somebody comes in and gets a BioRePeel treatment, and within a couple of days, they should already have the kind of tightening and the glowing and the cleanse, the clean skin and the tight pores and that type of reaction, even just as a standalone, a kind of a one-off treatment. But as you're kind of building out your multi-treatment series, going through a protocol, going through a plan, there's going to be some cumulative result that's going to take place over that time, and is going to to address the pigmentation or the melasma or the acne or whatever, and that'll have that again, there'll be a cumulative effect over the second, the third, the fourth treatment in the series, that'll become more pronounced, more obvious, more visible, and those results will be more substantial or substantive, I suppose, in that context. In terms of treatments in a series, so I just kind of touched on it, but again, if it's somebody comes in, I want to rejuvenate my skin, I want to clean it up, whatever, that could be a one-off type of a treatment. They could do it once a month, whatever, you can make a plan out of that. But if you're going to be trying to address a particular skin concern, you're typically going to want to be doing a series of 4 sessions with the product. The sessions can be stacked every, one treatment every 7 to 10 days with the topical application. And so you're going to be able to deliver, this 4-session series over the course of, sort of 30 to 40 calendar days. So it's going to be a small window, a number of treatments kind of back to back to back. And so, and it's doing 2 things. It's, from a business perspective, you're recognizing the revenue, you're delivering the services quickly, you're bringing the patient back to the office on a regular basis. Maybe there's other services they're getting or stuff they're buying because they're there or whatever. So there's, kind of business reasons why that's wonderful. And then from the other side, from a clinical perspective, you're delivering results quickly, the patient is seeing those results quickly. And so there's not like months in between peels. And so you're able to really kind of get after conditions and deliver results in an expeditious manner. 7 days is kind of your window for the, on the sort of lower end for standard topical application. If you're doing like advanced protocol, which might involve, mixing of the gold and the blue for spot treatment and things like that, you may want to be on the sort of larger side of that window just to give a little bit more time in between treatments. But as a general matter, that sort of 7 to 10 days is going to be your optimal window between treatments in a particular series of 4. The BioRePeel Gold frankly, the only real difference between this product and the blue product is the percentage of TCA. Everything else in the product in terms of formulation is the same. You're using your same, isopropyl myristate delivery system. You have your arginine buffer, you have your squalane, your amino acids, your vitamin B, et cetera, et cetera. So really all of that stuff stays the same, but the TCA content is higher. It's going to remain suitable for all Fitzpatrick's, suitable for the skin conditions, offered all year round. But basically, the gold is going to be primarily is a product that's designed for use on the body. So on the arms, on the hands, on the acne on the back, the elbows, darkness in the underarms, things like this, you would typically be going after with the gold product. But as I kind of touched on before, the gold can also be used as a spot treatment for melasma and pigmentation conditions and some acne and things on the face and the décolleté as well. So we do have some protocols inside of the client portal that talk about the melasma protocol as an example. We'll talk about applying blue on the face and then layering gold on the particular areas you want to get at. So not putting it on the whole face, but just to the areas where that darker pigmentation exists, or where that clustering of acne is, or whatever, to kind of really focus and target on those areas. And so that gold's going to give it some extra punch. But without having to put it, all over the face. It's going to be significantly more aggressive to do something like that. So, those protocols would call for the use of the gold as the spot treatment as well. The application of the product is the same. The multifunctionality of the product is the same. The expectation of results is the same. And so, again, the gold is really, again, not going to be fundamentally any different than the blue, just has a somewhat different use case. And again, that higher percentage of TCA, which sort of segues into the next slide, but which would lead to a slightly larger window in between treatments. And so again, if we look back at the blue, that slide about 7 to 10 days, when they were saying on the advanced protocol, you give it that sort of 10 days. If you're using the gold to layer on top of the blue, you might want to be on the larger end of that window, right? The more like 10 days. Here, if you're using BioRePeel gold on the back to treat acne, your window is going to be more like sort of 10 to 12 days. So a little bit longer, sort of, let's say, healing time in between treatments. But still, you're going to want that session of 4, that series of 4 to 5. You're going to want to have that sort of 10-day window in between, and and be and be working your sessions like that. So you still may end up kind of 4 sessions over 40 days type of thing to to go after a particular condition on the body. The only time that gold shouldn't be used on the body, just as a note, is like in and around the intimate areas. Okay, and so there we recommend still to use the blue with the lower TCA content there, and that's going to be your kind of go-to in that instance. But otherwise, really anywhere else on the body, you're going to be going for the gold, and using the gold in those instances. The underlying sort of science, right, that drives this product is really formulation at the end of the day. The quality of the ingredients, et cetera, but the combination of the ingredients and the formulation is really what drives the way the product behaves, the way the product performs. The shelf life of the product are all related to the formulation and the underlying science of how the product was put together. And it wasn't like by accident. The chemists that developed this had a very specific idea in their mind of what they were trying to create and what effect they were going for when they developed this product. And so, they have this, what they call this biphasic technology. So you have your lipophilic phase and your hydrophilic phase. And the lipophilic, when you look at the bottle, you see that it has this kind of clear, this clearly blue upper layer and this yellow layer on the bottom. And so that upper layer, that sort of natural separation of these ingredients, it's like an oil and water separation. The lower weight objects sort of rise to the top and they sit over top, and all of your kind of acids and the heavier ingredients sitting in the bottom. But that physical separation actually is drives the shelf life of the product, and allows it to be shelf stable, doesn't have to be refrigerated or anything like that, because that lipophilic layer serves to prevent the oxidization of the ingredients underneath, and so it prevents it from oxidizing quickly and allows the product to stay stable for a long time, even after the vial has been punctured and sort of open, as it were. You're still going to be good for 6 to 8 weeks with this product sitting on the shelf, in the cabinet, because that lipophilic layer protects the ingredients underneath from this more rapid oxidization. The ingredients, generally speaking, that are in that layer, however, are going to be those kind of hydrating ingredients, those ingredients that are going to protect or prevent the filming action and prevent the water evaporation, and also these sort of moisturizing and hydrating ingredients. In the hydrophilic phase, or the hydrophilic layer, you're going to find all of your acids and the TCA and the different those different ingredients that in the application are going to be the are going to be the ones that are in the that stimulate the fibroblast activity, that increase the cellular turnover, that is then in turn going to stimulate collagen and elastin production. So all of your active ingredients are generally speaking going to be found in the yellow layer in the bottom, and are going to drive the action of the product. One of the big questions is always about the contraindications. And so, contraindications for me, the sort of big call outs here are always retinol, retinoid, actives, and Accutane, basically. Pregnant and nursing, active bacterial infections or herpes or open wounds. This is like kind of common sense stuff that as a general matter, you're probably not going to be giving people, chemical peels that have open wounds on them or active infections and so forth. But the retinol, retinoid, and the actives, should definitely be avoided within sort of a week on either side of a BioRePeel treatment. And so in a practical sense, if you're going to be doing a one-off for somebody, they should stop the use of the product a week before and start the use of the products a week after, okay? But not in that window. If you're doing a series of 4 for somebody and you have a 7 to 10 day break in between each treatment in that series, if they stop using those retinol, retinoids, whatever, a week before, they're not really going to have an opportunity to start using them again until after you've completed the series of 4, because you only have a week in between anyhow. So there's never really an opportunity to get back to using them until after that treatment series has been completed. So, but with all of this being said, nobody's going to be dying on you because they use the retinoids and then they get the BioRePeel, but they are very likely going to have some flaking, or they're going to have more excessive dryness and things like that. So look, if they want to use those products and it's sort of in close proximity, no, I want to get the BioRePeel now, and they just stopped a couple of days ago, it's fine, but they need to understand that they're going to have some flaking, they're going to have dryness. It's not going to be that kind of no peel or whatever. There's going to be a little bit of peeling. They're not going to be sheet peeling like the VI peel type of stuff, but there's going to be some some effect that's going to be caused by the interaction of the two products. The only other call out again is the Accutane, and they're giving you like a big window, like stop it way before. And so that, any opportunity that you might have to head off Accutane use, because the results with this product are very, very strong for acne. I mean, I've seen fantastic results with acne. I've probably sent you all pictures of one of our clients that did like 3 sessions. She started in the end of June, and by July 17, she'd gone from like a full face of like crazy live acne to like, I mean, you wouldn't know they're the same person standing in the street, like, smooth skin, clear, just a little bit of like remnants of this, but just in 3 sessions for her, it's kind of, I mean, it's life-changing business what's gone on in those cases. And I've seen really, really incredible results on the acne. If you have an opportunity to get in front of the Accutane use and propose this as a as a starting point for somebody, in many cases, they're not going to need to go there, because you're going to get those results, and you can do multi-treatment series, take a small break, do another one. I mean, the Accutane is a recurring, I mean, you're on it all the time anyways, so there's not anything that's worse in this case to be doing repetitive series over a period of time, but you really, can expect strong results on acne with this product. So if you can get in front of the Accutane, beautiful. If you can't, then you really want to get them off the Accutane before you're going to start any kind of a BioRePeel treatment series. We touched on different modalities before, but basically, the sort of frontline skin prep, right, is going to be this forever kits that we provided, right? So we have our microdermabrasion gel. We're going to do some exfoliation. We've got the carbon salicylic mask. You're going to, degrease, take, get the oils off, open up the pores, get the skin ready. Then you're going to do your peel, and then you can have your, your post-peel hydrating serum, firming cream. But there are other modalities, other mechanical injury systems that can be applied as preconditioning of the skin and preparation of the skin. The dermal planing, the microdermabrasion, microneedling, hydrofacials, all of that kind of stuff can be done before, and then you'll do your peels. And then after the peel, you can move to, again, some of these kind of common aftercare stuff. So some people will do that. They'll put on the hydrating serum, and then they'll get the hyaluronic mask on and the LED light or whatever. So, so that kind of stuff would be done after the peel. Even injectables, if you're going to be doing, fillers or something like that, you could do the peel first and then do the fillers after. You wouldn't want to be doing the fillers and then you're going to start massaging the skin and moving the filler around. So you would do your peel first and then finish with your injectables. In terms of, and I mean, we're gonna start to move through this stuff in our, in the next piece of this, but basically the application, the standard application of the product, the standard topical application protocol is going to consist of sort of 3 elements, right? And as much as it's 7 steps here, it's really sort of 3 things that are happening. You're cleansing and prepping the skin, you're prepping and applying the peel, and then you're removing and finishing with your post care. Okay, and those things are all realistically going to be happening in the chair in your clinic, and not something that needs to take place outside, prior to the patient coming or necessarily after the patient leaving, right? And so the idea, I always tell people that, we don't do homework here, right? Nobody likes homework. We like to, have the patient come in, do the work for them, and then have them go, and they don't have to do any homework. So, here again, you're going to do your cleanse, you're going to do your application, you're going to do your finishing, and the patient, generally speaking, is going to be good to go. There is no aftercare regimen specifically. If they get dryness of the skin, they should keep the skin hydrated. If they're going to go outside, they should be wearing SPF. But other than that, there really isn't like a post-care regimen. You must use these products at these times in order to achieve those results. It doesn't work like that with the BioRePeel system. I mean, on the financial side, again, we've certainly sort of touched on this, and this is obviously one of the drivers for for a lot of people. I mean, you guys are running businesses, you're purchasing these products. You want to treat your patients. You want them to have success. You want them to have results. You also want to make money and keep the lights on and run your practice, right? And so, your cost on these products is really, I mean, comparatively, out there in the world of chemical peels, these prices are exceedingly low in most cases. I like to kind of reduce it down to a per milliliter cost, because the reality of the situation is that the amount of product that you're going to use on somebody is going to vary a lot depending on the area that you're treating. Is it just the face? Is it the face and the neck? Is it with the décolleté? Is it big face? Is it small face? Is it right? So there's a lot of factors that go into like how much product you're going to be using on any particular client for any particular treatment. So if you say your lowest common denominator is 1 milliliter of product, that's going to get me a face treatment for somebody. Your cost on that is $16.50 for that milliliter of product. You turn around, standard market price that I know everywhere in the country is going to be in the sort of $250 per treatment range. Okay, as like a standalone procedure. When you start bundling it together with other services, it can sort of get lost in the cost of those services, but your cost is that 16.50 per milliliter, or 15.25 per milliliter on the gold, or whatever. And so you know that anything you charge and above and beyond that, it is going to be profit in your pocket. And so, but that sort of price point, we really, want that people try to stick to that price point. The worst thing that can happen in a way is for the product to get devalued, and really for all of your purposes, to devalue the product by everybody kind of racing to the to the lowest price point possible. If everybody out there's kind of charging the same thing, and that's the expectation, and the product performs, there's no peeling, there's no downtime, there's no pain, this is what the client is paying for. I mean, there's an argument to be made, that there's a value proposition there. The product will not be, priced exorbitantly against other similar products, and so it's, it's a reasonable kind of proven price point that you can go to market with, that gives you a lot of room for profit on this, using these products. With that in mind, I'm going to stop sharing, and I'm going to kind of move over to product. So more than likely, most of you here are going to have like sort of this smaller format of the Forever Kit, the pre-treatment products, and then we're also going to probably have, I mean, maybe the smaller format, maybe the larger format of the of the post-care products and so forth. But everybody's going to have, a box of blue, okay, that sort of looks like this. So your procedure, again, the standard protocol of application, topical application, not combo therapy, nothing, is going to begin with your Forever Kit. You're going to start with your microdermabrasion gel. Again, this is going to cleanse the skin. This is going to do a light exfoliation of any dead skin cells, whatever that that first kind of layer of the skin that's there, and start to get the skin prepped. And so as far as application goes, and I have like the kind of the model here, my model here with me, but as far as application goes, like I like to just kind of shake it up a little bit, get it constituted, and then for me, I find this product to be a little bit runny. I like to I just generally going to put it on my hands, and then start to apply it to an area of the face, right? And then put a little bit more on the hands, and apply to the next area a little bit more, and apply to the next area. And the first pass is just really going to be to put product on the skin, not rubbing aggressively or doing that exfoliation yet, but just applying it to the skin. You'll take the activator spray, you'll spray it on that area that you've put this product, and then you're going to start with your more let's say purposeful type of massaging of the product, and working it in. And as you do so, once you've activated it with the spray, as you work it, it's going to turn, it's going to kind of foam up a little bit and turn white, and you'll feel the silica beads under your fingers as you're kind of working it around. But that's when you're going to really be doing your kind of exfoliation and your working of the product into the skin. And you want to sort of clean up all of the areas that that you're going to be treating with the peel, so that you get that good cleanse and that good exfoliation, the good prep. So do it, work it in a sort of a system, intentionally, get those areas clean, and then you're going to be able to clean this off with like a wet gauze or a damp sponge or something similar, just to kind of clean up the product off of the face after you've done that cleanse. Okay, and then you want to sort of towel dry so that you get so you're not, the skin's not going to be wet for the next step. The next step after that is going to be the mask, the carbon mask. The carbon mask, again, similarly, I just want to shake it up a little bit and make sure it's sort of mixed well. Either on the hand, sometimes you can just sort of lay it down on the area and then spread it out. And so this one, again, you're not going to be laying like a thick black mask. It's going to be still translucent. You're still going to see through it, but it's going to be black on the face and on the area where you apply it. So you want to apply to an area, kind of spread it out, apply to the next area, spread it out, so you make sure you got a good even coverage. With this one, you're going to leave it now for 5 minutes. So you want to start the watch or whatever and leave it for 5 minutes. And then after the product is sort of set for those 5 minutes, then you're going to bring the activator spray it around on the area. And 10 seconds later, just as after it sort of sets, you should already be able to start to peel off the layers of this mask just with your fingers. Like it'll roll off in little sheets. Okay, and so you can peel off from the whole area, clean it up, and whatever is sort of left behind and so forth. Again, just a wet gauze, some damp sponges, wet, towel, whatever, just to clean up the area. Really make sure that you get everything off, and then similarly, you want a towel dry. Okay, you're not going to be able to lose your way in this process. It may be something to kind of take in as we're talking through it now, but actually written on the back of the box are like step-by-step instructions. And you can always kind of refer back to these protocols. I mean, we have these written step-by-step how to use this in the portal and everything else. So, you're not really going to lose your way. And after you've done it a couple times, you're already going to know, like, you put this one, you spray the spray, you do it right. You know that this one waits 5 minutes, then you spray the spray. So once you've done it a couple times, it's going to be sort of second nature. But certainly the first time out, you don't need to be afraid that you're going to get lost because you do have the instructions on the box. Once that process is complete, now we're going to move to the peel. Okay, with the peel, your vial looks like this when you first get a fresh one out of the box. So it has, it has, first of all, the blue and the yellow layer. It's got a little a little tab on the top that's covering the membrane inside. And so you can just with a fingernail kind of pull that back and off. Some people use tweezers or whatever, but you can peel this layer back, and what you have underneath is like is going to look like this, right? So it's a kind of a this sort of foam membrane, okay, a little gray color, whatever, and it sits here in the top. And so again, the product is going to start as this this blue and this yellow layer, okay? And what you're gonna want to do as you're getting ready to use the product here is right away you want to take it and you want to shake it up so that the blue and the gold and the yellow are going to mix with each other. So it's just sort of 3 seconds. It's not super aggressive or anything like that, but then you're going to see that's going to turn this thick green color. Okay, and that's really what you're going for as far as what you're going to be using for application to the face or the body. And both the gold and the blue will behave the same way. They'll go from that separated blue and yellow to this thick green color. An important step to do is to aspirate the bottle once you've done that. I've made the mistake that I did this, shook it up, I put the syringe in with the plunger, and the plunger jumped out across the room because there was air built up inside of the bottle. So I learned very quickly that you must aspirate the bottle. So you take, I just take a little cannula, just push it in there by itself. And if there's a bunch of air in there, you're going to hear it a little hiss out, a little bit the air release, right? And once that's done, you can just kind of grab your syringe that you're going to use. You want to tip the bottle over and then just kind of draw your product out, okay, directly. You'll see that it's going to be thick and green inside of the inside of the syringe here, okay? And so again, as a normal course, you're maybe going to use sort of 1.25, 1.5 milliliters, something like that, to kind of treat the face and and get under the jawline and whatever, right? So my rule of thumb is always pull a 1.5 ml and get started. And if you see that you're going to need a little more, you can always go back and get more. I'm not a big fan of putting this product back in the bottle. You're going to be introducing air into the bottle. It could be I don't know, it can be messy on you. You pull it out and a little bit spills or whatever. So I always say better to take out a little bit less than you think you might need, because you can always get a little more if you need a little more. But with that being said, you're going to withdraw the amount that you want to use, and you can kind of set your bottle on the side. Anybody who's kind of watched any of these videos on, let me put on a glove over here, but anybody who's kind of watched any of these videos online, or you've seen it, they're all doing this like fancy, dots on the forehead, right? And that's sort of a muscle memory thing. That's kind of a learned skill, but the idea is that really, you want to be putting the drops, not because there's a particular, science to that or something. It's just really more about putting it in a way that's controlled, that allows for you to to have product on the face without it spilling all over the place on an area. And then you can you can kind of put down your syringe and then work the product into that area. And so again, typically you're going to start with the forehead. You're going to place some product down. You're going to start massaging the product. And again, I'm not pushing or doing anything like that. I'm just kind of massaging the product to activate it. So all those ingredients are going to start to mix together. It's going to give this nice kind of even layer of product on the skin. And you want to be massaging this until such a time as you start to feel that there's some tackiness developing. And on this mannequin head, it never really gets tacky, but as it starts to interact with the skin and the the oils of the skin and so forth, is going to start to become tacky relatively quickly. And so once you feel that tackiness, that's when you know that that product is activated. And for me, that's when the stopwatch starts. The 7-minute timer starts once I feel the tackiness on the first area that I've applied the product to. The idea then is that you're going to work, I mean, in a similar fashion, you're going to work your way methodically, right? So you do the, the forehead first. I'm going to do the, this cheek second, right? And the side of the face and the jawline down here, right? So I'll apply to this area and then work in this area, okay? And then I'm going to apply to this area and I'm going to work in this area. And maybe I'm going to go on the neck or underneath and I'm going to work in that area. So you're going to kind of make your way around in a purposeful fashion, okay, in a sort of a methodical way, and in doing so, be cognizant of the time that it's taking you to do that. So if I start here and I start the clock, so my 7 minutes is starting now, and then I do this part of the face and it takes me a minute, and then I do this part of the face and it takes me a minute, right? So now it's 2 minutes has gone by up here, but no minutes have gone by over here yet. And so when it comes time that I'm going to start to clean the product off, again, you want to be cognizant of the amount of time that it took, because the clean off is going to be faster than the application, right? Because you don't have to massage it until it becomes tacky and whatever. You're just going to like kind of wipe up that area and it's going to be cleaned off in 20, 30 seconds. Okay. Whereas maybe it took a minute of working it in order to become, between the application and the rubbing before it's, sticky and ready. So if I clean up here in 20 seconds, I want to give it, another 40 or 50 or whatever before I start to clean the next area, and similarly before I start to clean the next area, so that all of those areas that you're working are going to have that same amount of exposure time, a consistent exposure time all the way around the different areas. And so, so again, so you do your application, you wait your time, and then you start your cleanup. And the cleanup, similarly, no special neutralizing this and that. It's damp cloth, damp sponge, and not not to be wet that the water's running down, but just damp to to kind of clean it. Now it's very sticky, just damp to kind of clean it, clean off that area. You can wipe it with a dry towel and then start to go over to the next area and there with the damp towel and then with the dry towel. And so you just want to make sure that really all the product gets cleaned up off the face, off the whole treatment area, okay? And then that you towel everything dry nicely, so that when you're going to move on to the the creams application or the serum application, it's going to be onto the, I mean, it's not going to be bone dry skin, but at least going to be dry skin. Once you've so to that point, so now you've kind of completed your peel, you've completed your cleanup, you're going to go to the rehydra. Okay, the hydrating serum is going to be first. It's going to be one pump of this is going to be more than enough, like to get an even coating on the face. And it's the type of thing that it's like any serum, like any cream. You want to maybe get it on the hands, start to put it on the face, and really sort of massage it in, work it in until it's absorbed in the skin. Okay, and not to leave traces behind or that it's kind of wet, but you really want to make sure that it gets absorbed nicely and onto into all the areas that you've applied the peel. Once you've done that, then you'll do similarly, just one pump of the firming cream. Same deal, get it on the hands, apply it all over to the area that you've treated, and massage it in until it's cleaned up, that you don't have any kind of white residue left over or whatever. Really make sure that it's absorbed well. These are really important steps. in the process. And I think to the point almost overlooked by a lot of people in a lot of cases, or undervalued, okay, by a lot of people in a lot of cases. But it's actually really an important step in the overall performance, like as it relates to the whole side of underlying science of how this works, right? You have your skin prep, the cleanup, the degreasing, the deoiling, the pore opening, the skin activation in the first part. You have the application of the peel, the absorption of that, the rapid absorption of the TCA through the use of the isopropyl myristate, the delivery mechanism. It's moving, it's right away starting to move down, purposefully to the to the dermis, kind of not sitting around on the epidermis, on the upper layers of the skin, but really making its way down, and starting to go to work and starting that chemical injury process and so forth. And then what you're doing here is now taking the hydrating serum, the nutrients, the moisturizing ingredients, the hydration, and sort of backfilling those channels with this, with the ingredients of the hydrating serum and this product, and then finishing with this firming cream that's going to have that action of kind of tightening the pores and firming up the skin, and really locking in the hydration underneath and the chemical activity underneath that. So those, those layers, that layering of these products, and the slow release of this hydrating serum as it, as it sits in the skin and kind of permeates. This is all, again, kind of purposeful science. It's not some accident. Oh, they made this. They made it on purpose to behave in a certain way and to do things in a certain way, to stave off the excessive dryness and the flaking and the peeling and all of that stuff by keeping the chemical injury in the lower layers of the skin, and then having this hydration, this nutrient rich formulation sitting in those upper layers, delivering moisture and delivering nutrients to the skin while that chemical activity is taking place. So really important. I mean, far more important than the preparation, because the preparation, there's 101 different combos and methodologies and things you can do to prep the skin and clean up the skin and exfoliate the skin and so forth. But finishing with these products, to me, is really super important, in ensuring that you're really kind of following the science, as it were, with regard to how this product is supposed to be applied and how it's supposed to perform. So, again, once you've done your, your prep, you've done your peel, you've done your post, that's really kind of the end of the story. And again, the patient's not going to need to now go home and every 2 hours they got to do this, and they got to peel the skin, and they got to do all kinds of stuff afterwards to, to maintain these results or enhance these results or something. The product just has to start, the product's just going to be working for the next few days and doing what it's supposed to be doing. If they see that they're getting some dryness, hydrate the skin. If you're going to go outside, wear the SPF. But other than that, there's not going to be any prescribed post-care regimen that must be followed in order for the product to perform in the way that it's supposed to perform. So with that, I mean, that, again, there's really not much more to it, and I think that's also one of the kind of fringe benefits of this product is that there's not a big learning curve here to figure out how to use this stuff. There's not anything that the customer needs to do that's like, way out of the ordinary. Oh, they got to do this and they got to prep for a week before and whatever. It's come in, don't come in with a full face of makeup. Come in, get the procedure done. Get your finishing creams, put some SPF on, go back out in the world. Okay. And that's really all there is to it. And again, the results are going to be there. We're not having this conversation today. You didn't buy this product because you're like wondering, maybe it works. Like, we're here today because it works, because you've seen it works, because the internet is on fire with examples of how this product delivers on the promises that it makes. And so, with that being said, now you've got the the product in hand, you've got the tools, you've got this sort of context, a little bit of the knowledge. The only next step is put it on somebody's face, feel the silica beads under your fingers, see the little white foaming action, peel the stuff off, right, when you're done with the mask. You know, feel the stickiness of the peel after it sets. I mean, that's it, just that muscle memory is the only next step to making this, you know, to kind of taking that knowledge and you know what's out there and making that some kind of a reality for you in your own practice. So you know, so I think, you know, kind of with that, um, I'm gonna jump into the chat over here and turn it over for some questions. Janae is asking where we can find the protocol for use with the hydrofacial. So I do not believe, you know what, give me 1 second. We'll actually, we'll talk about the client portal on that right now, actually. So I'm gonna share my screen here. Share my screen here. Here we go. So in the client portal, I'm just going to check now if we have one specifically for the hydrofacial or no, because if we don't, it looks like no. I would check to see if on the through the Facebook page, there's I'm going to say with a high degree of certainty that people have posted both written and videos, protocols around the use of hydrofacial. And I know for certain that like Savannah Boda posted a couple weeks ago on her Instagram a treatment protocol where she was doing dermaplaning and then hydrofacial and then BioRePeel. So I know a lot of people have posted about that before, and that information is out there for sure. I can try and get something internally to see if I can get something to you like that. But again, as a general matter, you're going to be able to find that. You're going to be able to find that on the Facebook page for sure. The other thing is, I wonder if we might have something on our YouTube page. How to use the BioRePeel. I'll check and see about if I have anything internal. But as I say, I would definitely be taking a look on the Facebook community for that, because there's presentations that there's protocols that I've seen there for 100%. Let me see. Are you supposed to get a link to the portal? Absolutely, you are, Jenna. And it would have been in the welcome email that got sent when you first signed up. But I'll make a note for myself to send that to you, Jenna. Client portal link. Yes, I'll make a note for myself to send that to you just right after we're done here. At what step would we do dermal planing? Josie is asking. Do we still do the pre-treatment if it's performed? So the dermal planing is going to be before, okay? And so and actually, I was out in West Palm Beach the other day. I did a demo for somebody out there, and the esthetician that we did that the treatment was done on, she dermal planed herself in the morning, like a couple hours before I showed up there. And so we skipped the microdermabrasion gel and the mask and stuff and kind of went right to the peel. And so as a general matter, that's basically what you're going to do in that instance. You know, you don't, if you're already dermal planing, you don't need to exfoliate, you know, or something like that. And the skin's going to be pretty activated after dermal planing as well. So that dermal planing, if you're going to do that, like and do that sort of combo therapy, you'll do that as your you know, preconditioning phase, and then do your peel, and then do your post care. Okay, and so so with that, you know, you'll want that to be your sort of first step prior to doing the peel, and then doing the peel. But no, you wouldn't really use the pre-treatment in that sense. Like, I don't know, maybe you might cleanse the skin or something, but you don't necessarily need to use the Forever Kit products for that case, because you're going to be achieving that exfoliation anyways. Yeah, so Janae, I'll check and see what I can find about that for sure. Protocol for microneedling, are the times any different? So yes, and we sort of touched on it there, and I think actually also in the portal there's definitely a you know, protocol for microneedling and also a video about microneedling, but the times are going to be different. You're going to want to have a larger break in between sessions when you're doing the microneedling. And I know of a good protocol that a client of mine was using, where basically they did, like, the first treatment in the series was topical. 7 or 8 days later, she did a microneedling session. 12 days after that, she did another topical application. And then 10 days after that, did a microneedling session. So basically, there was like 3 weeks plus in between the microneedling sessions, but still the 4 treatments were in kind of close succession. Okay. And so, the time between the microneedling sessions was big, but the time between the BioRePeel sessions was like, let's say, sort of on the higher end of the 7 to 10 days type of thing. So a little bit more healing time, but not to do the needling until like 3 weeks after the last needling session. And so, that type of thing, yes, you are going to want to give a bigger break for sure between the microneedling sessions, because you have that kind of more significant mechanical injury component. But you don't want to extend out too far either, in order to keep those, the tightness of the recurrence of the sessions, to have that that kind of, make the most of that sort of cumulative effect of doing things over that time. The advanced protocol said when added to microneedling, we can't go up to more than 0.3, 0.4. If we want to go deeper, we need to do a double microneedling after removing the peel. Can I speak to that a little bit? I would be quite honestly out of my depth to try to talk to, too much to like specifics about microneedling like that. I can say my experience about microneedling, 0.25, 0.3 for microneedling the BioRePeel onto somebody's skin. Okay. We have mesotherapy serums that are going to be used for much more deep microneedling, and that type of thing. But as a general matter, the microneedling you want to do here is only really going to be a surface microneedling, and not anything more significant than that specifically. Okay. Again, I think a question like this is well suited for the Facebook community, because there you're going to get feedback from other professionals that are doing this every day, that have a broad range of experience. Our medical team and our esthetician team are going to be, they see those posts, they put comments on there. So I think, again, I know what I don't know, and I don't know enough to feel comfortable to really, kind of comment specifically on that. But again, I think that part of the reason why that, that private Facebook community exists is for questions like this, and for people to get on and really get the feedback from those people who have already walked down that road, and they know what it's supposed to be, and how it's supposed to be. So so I would ask that question there to get some more, for somebody to expand on that in a way that's going to be intelligent for you. On the Facebook page, a few people were saying that they have seen peeling 10 days post-peel. Is this a skin barrier issue? I would say that it probably is. And I think that, something like that is like exceedingly rare. To the point I've never heard of it. I didn't see those comments on the Facebook page. I'm not, going to confirm or deny, but I've never seen, any kind of peeling or flaking or whatever that's lasted that long. I know of every once in a while I get somebody, I have this patient, I did it for her and she's flaking, here on the chin, around the mouth, around whatever, right? And it's like, and I'm never alarmed by that. I say, okay, tell me what's happening in 2 days from now. And in 2 days from now, it's gone and the skin is great and everybody's happy and whatever. And so I don't get terribly excited about that. If 10 days later there was some peeling, something going on, there's going to be a contributing factor. It's just not, I really don't see, it's going to be a skin barrier thing. It's going to be that you told them stop using the retinol and they said, yeah, no problem. And meanwhile, that morning cream that they use has retinol or whatever. It's going to be something specific. But that's not going to be, a 99 out of 100. You're not going to see anything like that. It's to the point that I've peeling or shedding or flaking of any sort for that period of time, I've honestly never even heard of. So it's again, I don't doubt that the comment is out there, but I'm just not familiar with a case like that specifically. All right, so I think maybe that may be it for this evening. But listen, certainly if you're here and you have any other questions, or you want any other additional information or whatever, obviously, again, my work sort of starts after you buy a package. The real work for me is managing the account, being the primary point of contact, quarterbacking the questions and the requests and everything else. And so, definitely don't hesitate to reach out if you have any additional questions, or you need any additional help or assistance or whatever. And I'm here to work to make sure that you have the tools that you need and the information that you need to be successful with this, and to deliver results to people with this product. So, definitely don't hesitate to reach out if you need anything. And otherwise, thank you very much for attending, and I look forward to continuing to work with you. Thank you very much. Thanks, Josie. Have a good night.